Hi everyone, in this video I am going to be teaching you or giving you tips on how to care for your episiotomy or perineal tear after birth. My name is Edith Ndoka and I remain your dynamic nurse. Keep your eye glued on this channel. Make sure you watch this video from the beginning to the end because you're definitely going to learn something new. Before I start, I would like to first of all explain or define what episiotomy and perineal laceration is. Episiotomy is a deliberate cut that is given to a woman in her perineum during childbirth in order to give more room for the baby to come out. Episiotomy is also given when the doctor maybe decide to do what we call forceps or instrument delivery. Perineal tear, on the other hand, it is not a deliberate cut. This is actually an accidental cut. Probably the baby is coming out forcefully or the baby's head is a bit, bigger than the perineal opening. So most of the time women sustain what we call perineal laceration. And it's in different degrees. It has 1, 2, and 3. So depending on the level of the tear. Now, I am going to be giving you tips on how to care for both episiotomy and perineal laceration after birth to have a quick healing. Remember, both episiotomy and perineal laceration are sutured after birth. So now these sutures is what we call absorbable sutures. They don't need to take it off. It's not like some sutures they give during major surgeries, and maybe after 7 or 14 days, the doctor will ask you to come back for them to take it off. So in episiotomy or perineal laceration, the sutures they use is called absorbable sutures. So the body will absorb these sutures by itself while it's healing. So you don't need to take it out. The number one tip for quick healing or recovery of episiotomy or perineal laceration is adequate rest. Yes, after that, you need adequate rest. You need to rest your body, including the site of the injury. You don't need to put much stress there so that the sutures doesn't break, because if it breaks down, you might have to go back for another suture, which is another pain itself. Another tip is what we call sitz bath. Sitz bath is very important in the sense that it helps to remove physical debris, okay, in that region of or the site of the episiotomy or perineal laceration. So sitz bath involves you dipping your perineum or your hip inside a tub with warm water. Okay, I didn't say hot boiling water. All right, so you don't injure yourself. It has to be like warm water. You can stay there for like 20 to 30 minutes and that's it. Another thing you have to do is what we call maintain good personal hygiene. Oh yes, good personal hygiene is very, very essential in the care or in the healing of episiotomy or perineal laceration, because that place needs to be clean and void of microorganisms, because when it is dirty, it encourages the growth of microorganisms, thereby breaking it down. Another thing you have to do is what we call keep yourself hydrated. You have to drink lots of water to keep yourself hydrated and to prevent constipation, because if you're constipated, you will be straining while you're trying to defecate, and that could put strain in the area of the perineal or episiotomy, and it could lead to breakdown of the sutures. Another thing you have to do is to eat good food. Eat balanced diet. When you eat good food, the body makes use of the nutrients that you add to aid healing. Another thing you have to do in order to aid quick recovery of episiotomy or perineal laceration after birth is avoid strenuous activities. Okay, like lifting heavy things, or involving yourself or indulging in strenuous exercise or strenuous movement. That could lead to breakdown of the sutures, thereby leading to breakdown of the wound. Also, make sure that you take some minimal steps in a day so that it will encourage blood circulation to that area to aid healing. Another thing is make sure you take your prescribed medications, because most of the time as you're going home, the doctor will prescribe some antibiotics, prophylaxis, or some vitamin C. Those aid in healing. So you should make sure you take your prescribed medication. Another thing is you might want to ask your doctor when it is safe for you to resume intercourse with your partner. Okay, so that you will avoid breakdown of that area. You might also want to use some ice pack if there are some inflammation, okay, that is painful. You try to use some ice pack in that area just to aid or relieve the inflammation of the pain temporarily. Also, while sitting down, if it is possible, you try to avoid everything that will put stress on that place. You can get a ring pillow, the round ring pillow, put it on the chair. So when you sit, the hole in between will also keep the perineal area away from directly pressing on the chair. So that also could also aid healing. Another thing you must do is wear comfortable cotton on this. Okay, so when you wear comfortable cotton on this, it will help not to, you don't need to wear a on this that is too tight, so it won't put pressure in that area. You don't need to wear a nylon on this, so it won't encourage moisture in that region, so that it will encourage the growth of bacteria. Okay, so you need to wear comfortable cotton clothes, so that place needs to always be dry and clean. Okay, thank you for watching. I hope you have learned something from this video. Please don't forget to click the subscription button and the notification bell, so when I post my next video, you will be among the first people to watch the video. Thank you for watching once again. See you in my next video. Bye.